Thank you so much, Sean. All right, so how much do you know about what's going on inside your body? The Thyroid Association estimates that 20 million Americans have some form of thyroid disease. As many as 60% are unaware of their condition. And here with more about the facts and what thyroid does for us is Dr. Paul Tomasic. He is the medical director for Well Health Endocrinology and Primary Care. Good morning, doctor.
Good morning.
Okay, we're here to talk all about how to maintain a healthy thyroid. But first, can you talk to us about what a thyroid is exactly?
Well, the thyroid is a gland that is located within the neck, in the front part of the neck, low down in the neck. It is a gland that is a hormonal gland, so it makes hormones that have effects elsewhere in the body. It makes T4 and T3 hormone as its major hormones that carry out those effects, primarily regulating metabolism of the body, involved in things such as energy expenditure, temperature regulation, weight, cholesterol metabolism, to name a few of its functions.
Can you point to where, when you say your neck, in the front part of your neck?
Right. So the thyroid is located below the Adam's apple, but above the notch where the breastbone begins.
Right.
So kind of right in between.
Okay.
Now, normally, patients cannot feel their thyroid. It is of a size that cannot be felt when it is of normal size.
So how do you know when you have a problem with your thyroid?
So the problems that occur with thyroid fall in two major categories: hyperthyroidism and hypothyroidism.
Okay.
And so the concern is when there are symptoms that may be related to one of those two broad conditions in terms of thyroid.
And the main difference, hypo, let's talk first about hypo.
Sure. So hypothyroidism is when the body is making too little thyroid hormone.
Okay.
And so when there's too little thyroid hormone, in a general sense, there's a slowing of body systems.
Okay.
And in this case, the symptoms can be fatigue, it can be weight gain, it can be constipation, a feeling of cold all the time, dry skin, generally slowing of body systems.
Okay, so when you feel or when someone maybe is gaining weight for no apparent reason, they watch what they eat, you could have hypothyroidism. Exactly. Okay.
And when symptoms occur that could be thyroid related, a thyroid screen with a blood test is very important and should be looked for. Now, at the same time, many of these symptoms of hypothyroidism can overlap with other conditions. So it's not always the thyroid, but it is one of those things that should be examined for and looked for, most commonly with a blood test.
Okay, let's talk about hyper. I imagine it's the opposite.
Yeah. So hyperthyroidism is when the thyroid gland is making too much thyroid hormone, and generally there's a speeding up of body processes. And the types of symptoms that can occur are trouble sleeping, unusual anxiety, nervousness, sweats, feeling heat intolerance in an otherwise comfortable room for other people. There can be weight loss, appetite suppression, but interestingly enough, in some patients, they can actually have a stimulation of appetite. There can be weight gain in some hyperthyroid patients. In women, it could be a lightening of the menstrual period or a missed period as well, could be a clue for hyperthyroidism.
Neither one is healthy, right? Because when you say like a lightened menstrual cycle and losing weight, you think, oh, if I had hyperthyroidism, I wouldn't say anything.
No, exactly.
But
so sometimes I have to break the bad news that losing weight because you're hyperthyroid is not necessarily a good or a healthy type thing.
Okay.
Exactly.
So what kind of medication do you take? How do you regulate your thyroid?
Well, in the treatment of hyperthyroidism, we can talk about that first. In the most common forms, there are medications that are anti-thyroid medication that slow the thyroid down to get your levels to a normal level. And in many cases, those medications can be used for a year or two before tapered off, and the thyroid levels can stay normal in something we would call remission when they remain normal.
Okay.
The thyroid levels can sometimes return to hyperthyroid over time, and so the patient still needs to be monitored.
Okay.
And in some cases, the thyroid needs to be shrunken or destroyed by radioactive iodine treatment, or even sometimes taken out by surgery in cases where the medication doesn't work. And that's just for the hyperthyroidism.
Okay.
And then hypothyroidism, it's replacement with thyroid hormone, a medication usually taken once a day until thyroid levels are normalized, and blood tests are followed every few months until the levels are normal, and then monitored less frequently.
For someone out there who says, that's too much work, I'm fine, yes, I'm a little heavier, or maybe I'm really thin, what happens if you don't take your medication? What are the long-term effects?
So in the case of hypothyroidism, not taking the medication can result in a worsening of those symptoms that I mentioned before. Sometimes things can happen that aren't noticeable by the patient. There can be a worsening of cholesterol metabolism that may affect the cardiovascular system over time. There can sometimes be a change in thinking, what I would call cognitive impairment. Common forgetfulness can sometimes result, and you don't even know that you have a thyroid condition going untreated. If it goes long enough, then the symptoms can become quite severe and can become, in fact, a very dangerous situation with profound hypothyroidism. In the case of hyperthyroidism, when there's too much thyroid hormone that goes untreated, the main concern are effects on the heart. It can stimulate an abnormal heart rhythm that can be dangerous. And then there also can be effects that go silent, but the effects are still there, such as bone loss that can occur at a more rapid rate than with normal aging, putting the patient at risk for osteoporosis and fracture. So there are long-term consequences to going untreated with either condition.
Sure. And how are you here to help?
Well, as an endocrinologist, I am a specialist in thyroid disorders, as all endocrinologists are. Many of these conditions, especially the most straightforward hypothyroid cases that are most commonly would be treated with your primary care provider. But as an endocrinologist, we would be consulted if the thyroid levels don't normalize as expected, or there may be a more unusual cause of hypothyroidism, and there are more unusual causes. As far as hyperthyroidism, we really are the experts. I mean, there are doctors out there in primary care who are very comfortable with treating hyperthyroidism, but we are the experts, and as endocrinologists, we would see most of those cases.
Fantastic. Well, thank you so much for the education. I feel like I was just in class right now. I love that. Know the status of your thyroid. If you have questions, contact Well Health Endocrinology. Their information is listed right there on your screen. They are also on Facebook and Twitter. Always monitor your body. It's so important. Thank you, doctor. We'll be right back.